Hello and salam Sujatra. My name is Bala. I'm representing my team from University Science Malaysia to introduce our product named MyToxData, the Malaysian Toxicology Database System. According to WHO, poisoning will be a significant threat to the public health globally. Approximately 21,700 poisoning admissions to hospital were reported over a 3-year period in Malaysia. These numbers are just the tip of the iceberg. The actual hospital admissions are much higher, not including those mild poisoning cases that are treated in the emergency department, which does not need any hospital admission. One of the main functions of the National Poison Center, also known as the Pusat Racun Negara, is to provide toxicology information service in managing poisoning cases in the country. We receive around 4 to 5,000 poisoning exposure calls and queries annually. The most common types of poisoning cases referred to National Poison Center by types are pharmaceutical products, pesticides, and also household products. However, do you all know that we do not have a standardized register for local chemical-based products such as household products in our country? The NPC receives multiple requests by government agencies, healthcare professionals, pesticides companies for various data involving poisoning cases. There is no official poisoning register out there. And in fact, there is a lack of standardized and centralized poisoning reporting site in the country. The NPC have paper-based poisoning case report based on call inquiries. On the other hand, Department of Occupational Health and Safety, which is DOSH, have their own system for reporting occupational disease poisoning. Ministry of Health Occupational Health Unit gathers forms submitted on occupational poisoning notification. And obviously, we have Ministry of Health hospital admission data from MOH Health Informatics Center. All these lead to underestimation of actual burden of poisoning in the country. The solution of this problem is MyToxData, a web-based system to enhance effectiveness and efficiency of toxicology-related services and research in Malaysia. It was developed with a full collaboration between National Poison Center and Center of Information, Communication and Technology from University Science Malaysia. The four main features of the systems are toxicological case reporting or notification system, drug poisoning identification, clinic information retrieval, and the fourth one is the statistic report access. Very important. I think this is very important system. MyToxData will provide a one-stop toxicology hub, centralized poisoning reporting site, drug or poison identification, chemical product database, a 24/7 clinical information access, and access to poisoning statistics. In terms of novelty, we can assure that it is the only system available in Malaysia with the integrated poisoning cases data collection with clinical management information retrieval. The second novelty is provides a centralized platform for poisoning reporting both by public and private healthcare professionals. The database on local chemical products and identification tools will be the third novelty inventiveness of MyToxData. It also has real-time analytics, secure login access for the data protection, and allows quick reference for management of acute poisoning cases with the ability for complete notification around the clock. The table shows the competitors and the price comparison of products available in the world. It is very clear that none of the products have all the four features in one system as we do in MyToxData. In terms of price comparison, it is obvious that our product is the cheapest in the market. For example, we can make a direct comparison with Micromedex. I'm sure all of us know what is Micromedex. It is the most widely used drug and poison clinical information database in the world. The annual subscription for Micromedex is 45,000 ringgit as compared to only 10,000 ringgit for our advanced licensed user for MyToxData. In fact, our basic user function is free to be accessed by any users. In terms of practicality, it will be one-stop hub for toxicology data information. Indeed, It is a web-based system with no installation needed, paperless and more sustainable. MyToxData allow options for quick access of information, and as I mentioned earlier, it is free access for basic users. MyToxData has easy and quick login access, and it is mobile compatible. The usability study shows a positive user experience. Improvement of the system was done from the users' feedback during the study. Patent search revealed 600 patents have been filed, and it is in the increasing trends over the year. There are 0 patents have been filed from Asian countries. The top owners of the companies are from the US, European Union, Australia, and also several other countries. There are 2 copyrights successfully obtained for this product. One for the MyToxData system and another one for the clinical toxicology information training module. Part of the development of this system was supported by the Research University Scheme Grant, USM. We have successfully published 4 full-text journal articles in various index journals from Q2 up to Q4, which is in Web of Science. In addition, we also have 8 conference proceeding abstracts published from various national and international conferences. The status of Invention is level 9 with full commercial application. The product already been commercialized to International Islamic University Malaysia Poison Center. We have 1 MOU for research collaboration with them, 1 MOU for system licensing, which is 20,000 ringgit for 2 years, and 1 MOA for training and consultation, which is 32,000 ringgit. High potential for commercialization because it is low cost for drug and poison information, have safety data for industry and government, and also for toxicology surveillance. Other potential for commercialization in public sector is 146 Ministry of Health hospital and almost 1,200 Ministry of Health clinics. Private healthcare facilities including 208 private hospitals and almost 8,000 private clinics are definitely in our list of target, apart from the numerous pesticides, chemical and pharmaceutical industries. I'm sure they are very interested in this system. These are the list of potential partners, with the number 1 in the list is definitely Ministry of Health, Occupational Health Unit, Emergency Service Unit, and Pharmaceutical Service Program. Second is the Department of Agricultural, consists of Pesticide Control Division and Pesticide Board. This is followed by the Department of Occupational Health and Safety, DOSH. Ministry of Domestic Trade and Consumer Affairs. These are very mainly for the household products and digital healthcare industries. One of the partnership we are having discussion now is the Remedy Innovation Center Berhad. Other potential for system licensing, subscription of customized data, and research collaboration are other poison center from low and middle income countries and from Asian countries, all the regional Asian countries. University hospitals, private hospitals, and clinics, and chemical industries. The impact of the product can be divided into 4 categories. For society, the reliable toxicology information access will reduce the mortality, morbidity, and hospital stay through improved efficiency in toxicovigilance, which can lead to improvement in policies and development of various poisoning prevention strategies. The economic impact is in the reduction of healthcare costs in managing poisoning-related admission. Don't forget the sustainability aspect of the product. It allows for paperless and also environmental-friendly ecosystem for the expansion of toxicology-related services and research. The impact on industry is without doubt on the database compilation and product safety profiling. This product contributes towards achieving SDG Goal 3 on good health and well-being. Let us now look at the basic feature of the system function. I would like to thank all the collaboration and people involved in development of this product. Thank you.